Okay, Miss Kelly. So tell us a little bit about your migraine. I guess your more or less like TMJ type issues, kind of from beginning, and we'll just kind of go through and touch on some things.
Okay.
Okay.
Well, my name is Kelly Carpenter. I have had migraines for as long back as I can remember, and I pretty much tried every form of therapy from prescription medications to chiropractic care, physical therapist, acupuncture, dry needling, steroid shots. I'm now seeing a neurologist, and I'm getting Botox done every 90 days, so every 3 months. So just trying to get some relief from that. I do feel like, and it's hard with the Botox because of course they can't go in and inject in here. So, I wake up with just just tremendous pain from where I've been grinding and clenching all night long. I've suffered from it for a really long time and would love to get some kind of relief.
And the migraines is just one thing. And I know we have a little checklist we went through. So you did mention your TMJ pain, your ear congestion, kind of the numbness, tingling down the arm, all these facial pain, neck pain issues. Where does the root, I guess, source or pain come? Is it left side, right side, both sides? Where do you see that?
I do feel it on both sides, but I feel like, because I definitely can tell on both sides when I wake up and I've been grinding, but I feel like more of the issue is on the left side. I know I get a lot of treatment done like through this area. A chiropractor, even my neurologist does a lot more on this side because it seems to be more prevalent. I don't know. It's hard to tell.
Sure,
and I don't know how to tease out if it's the bruxism TMJ kind of thing going on, or a lot of times I'll get migraines with aura, but I also have noticed that my left side, I'll get the tingling, the numbness down the left side, and so of course that amps up my anxiety because I'm worried that I'm about to get a migraine.
And that probably causes one.
Yeah, so it's a vicious cycle, I guess.
Now you've not had any surgeries, correct? You've not had any type of TMJ surgery, nothing like that?
No, I have had multiple splints and bite guards and things like that.
From just your dentist for years?
For years,
okay.
Yes. And I know they've gone in and tried to fix my bite and grind down the teeth. And I have extreme sensitivity where I have to drink my water at room temperature, and there's, I can't eat ice cream and things like that.
And you've noticed your gums?
Yes, my gums are, right now I'm really concerned because they're just, I guess, receding really badly. I don't know if that is from all the grinding, and then of course with the roots being exposed, and then I also have, I had my front 2 teeth done, and then I can't, the color has been, it's been off, and it's, and I have trouble bleaching because of the sensitivity.
Yeah.
So, it just kind of
compiled.
Yes.
Now, as far as, I know you mentioned you have an autoimmune disorder.
Yes,
Can you kind of explain that?
Yes, I have the chronic form of Guillain-Barré, so it's chronic inflammatory demyelinating polyneuropathy.
Okay.
It's a mouthful. It's basically like MS, but of your peripheral nervous system. So I have a lot of the peripheral neuropathy, the tingling. I can't feel my fingertips, my toe, just I have a lot of issues with that. And so then there are other things that kind of spin off of that.
And the treatment for that, is that?
I have been on, I was diagnosed about 10 years ago, so I've been on multiple different treatments and therapies. I'm on medication. I did, for 2.5 years, I did IgG infusions every week. Goodness,
You've done lots of treatment with that.
Lots of treatment, lots of different medications, and I've also done more of the natural thing as well. So, yeah.
Now, do you have any other diagnosed conditions that you're aware of? Other than that one?
I know the Mayo Clinic did diagnose me with migraines with aura, the peripheral neuropathy thing,
Yeah.
But I'm trying to think of anything else that would be.
Probably not.
Yeah.
Okay. Well, we always like to ask the question of if you could have relief. I know as debilitating as migraines are, most people want relief ASAP. So it's obvious. You've exhausted the options. What would it mean for you and your family or your kids to have this treatment done where we actually are able to eliminate these issues? What would that mean?
It would be huge. It's something I've been searching for years. It's hard when you have to very active boys, and my husband travels all of the time, and I never know if I'm, it's like I can't even commit to certain things, and when I do, I'll end up having to call in because I've ended up with the migraine on that day.
Right. Now,
so
are you working?
No, I'm actually
No.
not. This condition, I was working when it came on.
Okay.
And
It just got to be kind of too much.
It was too much. Actually, I'm on disability because of it.
Gotcha. Wow. That's a lot. Well, we appreciate your time. Thank you so much. And we'll hopefully get you taken care of.
Okay.
We'll see you soon.
Thank you.
All right.